Okay, so today we will discuss about medical errors. First of all, I will tell you about the general approach to these type of stations, and we will take an example of the missed fracture to discuss the general approach. And after that, we will walk through these stations one by one. Okay, so regarding the general approach, we have 6 steps here. So the first step, like every Pleb 2 station, you need to read and paraphrase. All right. The second step is checking the current situation of the patient. So you will ask the patient about the present symptoms, and then you will ask about the past visit. So basically, in medical error stations, there are 2 visits. So in the first visit, there was some mistake on the behalf of the medical team, and now the patient has presented to you again, and now you have to tell him about the error. So that's why, first of all, you need to check the current situation of the patient, what are his symptoms, whether he has any red flags at the moment or not. And then you have to ask about the past visit, that is about the visit in which the medical error was committed. So there are 4 questions that need to ask about the past visit. Number 1 is, what were the patient's symptoms at the previous visit? Okay. Uh, what tests were done for him? Right. What treatment was he offered, and what was he told about his treatment? Okay. So these 4 questions you need to ask. Then the fourth step is telling about the error. So you need to give the patient a warning shot, and you need to tell him that we have committed an error in your medical treatment. I will discuss all of these steps in detail when we discuss the example here, so it will be more clear for you. Okay. Then the fifth step is managing emotions. So when you tell the patient that there was an error on the behalf of the medical team, it's almost guaranteed that the patient is going to show some emotions. He might be angry, he might be frustrated. So the management in these scenarios include management of emotions. So the major portion in management here is management of emotions of a patient as well. So he's going to show the emotions, and you need to manage them and acknowledge them. Okay. And then the next step is telling the patient that what are you going to do next. So it also includes 2 parts. So the first part, first of all, you are going to tell the patient what are you going to do next for him, like medically. Okay. What is the medical management that you will provide now when you have identified your error? Okay, and you will also need to tell him what are you going to do about the medical error that was conducted. So these are the 2 steps. And then at the end, you are going to tell the patient about patient advisory liaison services. So, which is called as PALS for short. So, in every hospital, there is a department which is called PALS, and it deals with the patient's complaints. Okay. So some people say that you do not need to tell the patient about PALS unless he asks for it, but this is actually the wrong approach, because in terms when medical errors is committed on the behalf of the treating doctor or the medical team, then it is your duty of conduct to inform the patient about PALS. You need to tell the patient that there is a department that deals with formal complaints, and if he wishes to do a formal complaint, he can contact them. Okay. The people who says that you do not need to tell the patient unless he asks for it, um, it's the right approach in case where the patient is angry and you have not committed a medical error. For example, take an example of where a mother comes and she asks about her daughter whether she's taking oral contraceptive pills or not, and you cannot break the confidentiality, but the mother is angry and she says that I want to complain against you. Okay, so then you need to tell her that there is a department called PALS, because in that case you do not need to tell her beforehand unless she asks for it, because you have not committed a medical error, so you do not have a duty of disclosing anything to her. So you need to tell her about PALS when she asks for it and not before that. Okay, but it's not the same case in medical errors. I hope I'm not making it too complicated for you. Okay, so now we will discuss the missed fracture station. So here the scenario is like a 10-year-old child was brought to your team 3 weeks ago, and he presented with a history of fall. And at that time, my next day was done for him in the emergency department, and the patient was told that everything is fine, there's no fracture, and he was discharged. But then the specialist radiologist reviewed the X-ray, and he found out that there was uh, a hairline fracture. So now you need to talk to the father of the patient. So how are you going to go through this case? So just remember your general approach. The first step is greet and paraphrase. So like every other prep tool scenario, you are going to introduce yourself and you are going to paraphrase the scenario that I understand that you are here because Andrew suffered a fall 3 weeks ago and you are here for follow-up. So he will say yes. So after that, ask about the current situation. How is Andrew doing now? Any symptoms? Any pain in his foot? Okay, is he able to walk? Any swelling? Any tenderness? All right. Then after that, you need to gather info about the previous visit. Okay, so what were the 4 questions in the previous visit? You need to ask them. Okay, so you need to ask the father, can you please tell me about the previous visit? What symptoms didn't you had? What tests did they do for him? What did they tell you? And what treatment was he offered? So it's kind of like you can remember it in a way like symptoms and then investigations and then diagnosis and then treatment. All right. So in the first question, you ask about what symptoms did he had at the first visit? What tests did they do for him? What did they tell you? And what treatment was he offered? Okay. So you need to ask these 4 questions. This is your data collection here. Okay. So there are 3 steps in the data collection. Number 1 is the current situation, current symptoms, then previous visit questions, and 2 parts for the data gathering. Current situation and the previous visit. All right. Then you need to tell the father about the mistake. So how are you going to tell about the mistake? First of all, you are going to give a warning shot. You need to tell the father that there has been, I'm sorry to tell you, but there has been medical error on our part in the treatment of your son. Okay. And you need to pause, you need to give a pause and let the father ask what mistake happened. Okay. And when he asks, you are going to narrate the whole story. Okay. So you're going to tell that so 3 weeks ago Andrew was brought and he was assessed by the doctors, and as you also know, they also did an x-ray and told you that everything is fine. Then the same x-ray was reviewed by the x-ray specialist, and unfortunately, I'm very so sorry to tell you, but he found out that there was a hairline fracture, which is a very small fracture in his x-ray. Then you are going to pause again, and after that, there is a guarantee that the father is going to show some emotion. He's going to get angry. He's going to say that, how can you miss an error? How can you miss a fracture on X-ray? How is that possible? All right, or the doctor is not properly trained and something like that. So here you need to acknowledge the emotions. So here what you need to do, you are going to listen to him attentively. And how can you show the examiner that you are listening to the patients attentively? You are going to note. Okay, now this is very important. Do not take this lightly. You are going to note. Okay, the examiner will be looking at your neck. So note when they are talking, note all the time. Okay, so this is the way of showing that you are actually listening to your patient. Otherwise, the examiner would think that you are not listening and you are not like properly reflecting. Okay, so when the patient displays the emotion, then you're going to acknowledge the emotion. So you're going to tell him something like, I can see that you are very upset, and anyone in your situation would feel the same. And clearly, it has been a mistake on our part, and we sincerely apologize for it. Okay. So this is like the acknowledging the emotions is basically managing the emotions. Okay. So you're going to nod a lot and you're going to acknowledge their emotions, and this is going to make them calm. Okay. So then we are going to discuss the next step. So you are going to tell what are you going to do next for the patient. So in this case, this is a hairline fracture. You need to tell the father that these fractures are very small, basically, and they're not expected to cause any complications and they heal on their own. Okay, so we are not going to provide any medical management because it is not needed at the moment. Okay, and you need to tell him what are you going to do in terms of the error. So you need to tell him that we at the hospital take this type of mistake very seriously, okay? And first of all, when such type of error happen, we document it as a significant event, okay? So when something is documented as significant event, there is an automatic investigations. And our senior will sit down and they will try to find out the root cause for this error. And once we have found out the cause, then we will take the appropriate action and we will be very open and transparent about our investigations. And we will, and if you wish to if you wish to remain updated, we will update you about our investigation and the outcome. Okay. And you need to tell him that if you wish to make a proper complaint, a formal complaint, then we can get you in touch with the appropriate department. And once again, at the end, you will apologize. So in this station, you will use a lot of, you will apologize a lot. You will say sorry, and we apologize for it. And you need to say, unfortunately, so stuff like that. These type of stations are quite easy once you get a grip of the general approach to the station. So this was general approach and one of the examples, and I will walk you through the rest of scenarios one by one.